So we're going to talk about patellofemoral pain, and it's basically a fancy catch-all term that physical therapists and doctors use to describe knee pain. But patello means your kneecap, femoral means the bone in the thigh and your upper leg, and then obviously pain. And what does it look like, or how does it present itself? Well, patellofemoral pain will occur when there's too much pressure on the back of the kneecap, or when the kneecap is tracking in a direction that isn't the proper direction. It'll present itself most times when you've been sitting for a period of time, like sitting at work or sitting in the car. Your knee starts to get kind of achy and sore. That's the pressure building up behind the kneecap and causing patellofemoral pain. It'll also occur with activity. So if you're going up and down stairs, or if you're walking, or especially after you go for a run or exercise at the gym. But the way that it'll usually present itself initially is just that soreness, that stiffness, that ache in your knee. That'll progress. It'll turn into a little bit of what we call crepitus, which is cracking and popping and grinding feeling, or you may even get to a point where you hear it. And then you can get to a point where you start to develop what we would call a monster walk syndrome, where your knees are so stiff when you first get up or after activity that it's difficult for you to bend them, again, because of that pain. There are some common causes to it. The first is that your kneecap, like I said, is not sitting in a position where it's supposed to, or it's not tracking in a position where it's supposed to. The second reason why you could experience some patellofemoral pain is that there's just any tightness around your knee. So muscles like your hamstrings, your quadriceps, your IT band, your hip flexors, your calves, if those muscles are tight, they're creating a change in the position of the kneecap. And the third cause of that can be that there are some weaknesses in the muscles around your knee. Very commonly, we will see that most people who are experiencing patellofemoral pain have weakness in a part of their quadricep muscle called their VMO, their vastus medialis, and or some weakness in their abductors. And you think, well, I do a lot of exercise, my quads are really strong. Probably are. My abductors are really strong. Probably are. But the problem is your VMO, that one very small part of your quadricep, and your abductors are not equally strong, and so your kneecap position is being changed and the tracking is being changed, and that's what's causing that rubbing of the patella on your femur in a way that it's not common for it to happen, and it's giving you the pain. If you're having any cracking, popping, crepitus, grinding, soreness, etc. in your knee, you're experiencing some level of patellofemoral pain. There's so much that physical therapy can do to help you with patellofemoral pain. And really, it's a matter of figuring out what is causing the pressures or the tracking issues in your kneecap. That's really where an expert physical therapist at Loudon Sports Therapy comes into play. We can figure out what is causing your patella to press or rub in your femur or track on your femur in a method that it shouldn't be doing. We can then, through some manual techniques, some manual treatment techniques, change the position of that kneecap, get it tracking in the direction that it should be tracking in. Go back and take a look at what are the areas where you are tight, where you're getting that pull from muscles that you shouldn't be getting pull from. Look at your weakness and your strength. What is the balance really in that VMO and your abductors? And get those coordinated and balanced out so that that kneecap is tracking straight up and down the way that it should be tracking all the time. There's a lot of other things that we'll look at in terms of something that's called your Q angle. It tells us about the position of your foot and your hip in relationship to your knee. And we want to help you get patellofemoral pain under control, because if it goes unaddressed, it turns into things like arthritis. Long-term down the road, it turns into the need for a joint replacement, meniscus tears, ligament problems in the knee, etc. So again, something easy to take care of. Give us a call and we can get you started feeling better and doing all those activities that you want to do without any patellofemoral problem or any knee problems at all.